Good afternoon, everyone, and welcome to our virtual health talk. My name is Melissa, and on behalf of the Patient Education and Engagement Program here at the University Health Network, I would like to thank you for attending today's session, Keeping Your Eyes Healthy. Before we begin, we wanted to let everyone know that the UHN Emergency Department is now offering virtual visits from Mondays to Friday. If you're unable to access or don't have a primary care provider and have an urgent medical condition that isn't life-threatening, such as a painless red eye or have a bump on your eyelid, you can now book a same-day appointment online or over the phone. To book an appointment and get more information about this program, visit uhn.ca/virtual ED or call 416-357-2984. Thanks, everyone. So now, going back to the talk, I would like to take a moment to thank our planning team. First, the Patient Education and Engagement Program, the Patient Learning and Experience Centers, the Patient Partners Program, and Education Technology and Media Services. And a few words about our online format today. So this session is being recorded and will be available for viewing with closed captioning at this same YouTube link afterwards. Today we'll have a presentation for about 40 minutes, and then we'll open it up to the audience to ask questions for the rest of the session. To submit your questions, we invite you to go to the link on your screen. You can also scan the code using your smartphone's camera or QR code reader app, and you can submit questions anytime during the presentation. We want to quickly thank those who have submitted questions already. It helps us see what people are interested in learning more about. We have tried our best to address these within the presentation, but we'll definitely answer them again during the question and answer period. When you submit your questions, you may notice it doesn't get posted right away. This is because we're now reviewing questions before they show up for the audience. This just helps us make sure that questions won't be repeated, and it gives us some more time to address new and different questions. It can also help us prepare how to answer these questions before they're posted. We ask that you please keep in mind a few things before you submit your questions. One, so you can choose to include your name or stay anonymous. Please note that others will be able to see your name if you do include it. Please do not include any personal details about your health or condition in your question. Our health talks are for general health information only. The speakers are not here to diagnose or provide treatment recommendations, and we'll try our best to answer as many questions as we can during the question and answer period. You can also vote for your favorite questions by clicking the thumbs up button beside the question. This will help bring the questions closer to the top and they'll more likely be answered. And if you have any questions about the live stream during the session, you can email us at pfep@uhn.ca or leave us a voicemail at 416-603-6290, and a member of our team will get back to you shortly. And on the topic of technology, we realize that anything can happen when it comes to internet connections. So with that said, should my connection cut out at any point, don't worry, you'll be seeing one of my awesome colleagues step in to facilitate the session. And lastly, we would love to hear your feedback about this presentation. So your feedback will help us know what you found helpful, how we can improve our sessions moving forward, and what topics you would like to see in the future. So please go to the link on your screen and complete the survey at the end of the session, or you can scan the code using your smartphone's camera or QR code reader app, and it'll take you to the survey. Now, moving on to our presenters. So first, we'll hear from Mun-Fong Woon. He has worked in the IT field and for a charitable organization before he had to retire due to his health. Currently, he's a UHN patient partner, a peer facilitator for the Chronic Disease Self-Management Program that's run by the South Riverdale Community Health Center. Then we'll hear from Dr. Marissa Sitt. She's a comprehensive ophthalmologist at the Toronto Western Hospital at the University Health Network. She sees patients with a variety of eye problems, including cataracts, glaucoma, and diabetes. She performed surgery at the Toronto Western Hospital and also at the Kensington Eye Institute. She's a lecturer at the University of Toronto and is actively involved in teaching residents clinical and surgical ophthalmology. She received her medical school training at the University of Toronto and also completed her ophthalmology training at the University of Toronto. So we have a great group of speakers today. And before we get started, we would like to take a moment to acknowledge the sacred land on which the University Health Network operates. At UHN, We strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land and for thousands of years have cared for this land. In particular, we acknowledge that we're on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island. We're grateful to have this opportunity to work and learn on this territory. So over the next hour, I will be especially thankful to be on this land to hear from our experts and their strategies. We're all tuning in today because we're interested in learning more about eye conditions or want to get tips on how to keep our eyes healthy. For me, I know none of this would be possible if it weren't for the land that I'm on today. So no matter where you're watching this from, I invite you to take a moment to pause, recognize, or even look up the traditional territory that you're on. And this is another step I encourage you to take with me to continue to respect this privilege and recognize Indigenous people's beliefs, history, and as the original carers of this land. Now I'd like to turn it over to Mun Fong, who will be starting us off. Mun Fong, I think you're on mute right now.
Okay.
There we go.
Can you hear me?
Yeah.
Okay. Hi. Good afternoon, everybody. Yeah, my name is Man Fong Woon. I'm a patient partner here at the UHN, and I'm also a patient to a lot of department here. So a little bit of history. I was first diagnosed in 2001 with myasthenia gravis, which is an autoimmune disease that weakens the muscles of the body. Interestingly, it was actually an ophthalmologist that diagnosed me because one of the first symptoms of myasthenia gravis is drooping eyelids. So I had that problem and I went to see an ophthalmologist whereby he diagnosed me with myasthenia gravis, and then I was treated by a neurologist. So, but soon after that diagnosis, I was also diagnosed with thymus cancer. In fact, thymus cancer and myasthenia gravis sometimes goes together. So for the treatment of myasthenia gravis, I was given immune suppressing medications. And for the thymus cancer, I had an open chest surgery to remove the tumor and also receive a radiation therapy afterwards. After these procedures, I had about 10 years of medical controlled remission. But then the myasthenia gravis came back in 2011, and in a few months' time, it became a myasthenic crisis. A crisis means that the muscles of my body are so weak that I'm actually not able to breathe on my own. I'm not able to inhale and exhale on my own. So I was hospitalized for 4 months, and most of the time breathing with the help of a ventilator. During that time, all these things, I was living in Montreal. This happened when I was living in Montreal. So when I moved to Toronto, my neurologist in Montreal referred me to the neurological department in UHN. And so now, after all these years, I just counted, I'm a patient of 6 different clinics here within the UHN network. And okay, and one of which, of course, is ophthalmology. And I had because I had cataract surgeries in both eyes. I also have glaucoma, and my right eye has the higher pressure than my left one. And eventually, I need to have the surgery to drain the fluid and to relieve the pressure. I'm sure Dr. Sid can explain a lot more about this in detail later. So, but today I would like to share my experience and thoughts on staying healthy and while living with chronic condition. It was after I had the myasthenic crisis that I really started to learn how to live with chronic condition. These are some general tips and strategies that I have found helpful, and hope those of you who are watching also managing chronic eye condition will think so too. To start, I would say that in Buddhism, it's said that birth, old age, sickness, and death are unavoidable sufferings in life. But until I became sick and started living with chronic condition, I was not able to fully understand what sickness means. My understanding about sickness before that was that limited to short, acute sickness that can be cured, like cold or even a broken bone, appendicitis, for example. But I did not know nor understand the challenges of living with chronic conditions, something that I have to deal with for the rest of my life. With that, I'll say that now I understand how important it is to make other people understand how I feel or what are the challenges that I have to overcome. And this, including, I have to communicate this to my healthcare team. So this highlights the importance of good communication. Here, I would like to quote from the book, Living a Healthy Life with Chronic Conditions. We'll have that put up later in the talk. It says, good communication is a necessity when you have a long-term condition. Your healthcare team in particular must understand you. And when you don't understand advices or recommendations from your doctor, the result can be literally life-threatening. Okay, so that's a very good quote. So, but learning to communicate better is really an ongoing effort. And there are many, many resources that online or otherwise that can help improve our communication skills. So I found that one thing is that to have good communication with my healthcare team, I have to be prepared. So, for example, I will make a list of questions to ask at the appointment, or keeping a journal of how I've been feeling in between appointments. Because I take many medications, I always carry a list of everything that I'm taking so I can easily share it with my healthcare team, different healthcare team, when I need to. So perhaps the next time when you go and see your eye doctor or eye specialist, maybe you should bring a list of questions that you want to ask. And also if there's some certain symptoms that you had experienced, maybe you should let the doctor know, because the symptom might have come and gone, but on the day of visit, you should mention that to the doctor. And of all these things, try to prioritize which items are more important, so that even if we run out of time during the consult, at least we got the important points covered. And living with chronic condition, you may need the support of multiple healthcare professionals. The groups may include your family doctor, pharmacists, specialists, nurses, therapists, and so on. Among all these health teams, remember, you may be the only person that is aware of what each team is doing or each team wants to do. Therefore, you are the communication hub for all this information. You're the one that needs to disseminate these whatever happening to all the other teams within your group of caregivers. So that's you have a very important role to play here. And sometimes you may need to expand this group of teams. For example, your doctor or your specialist may refer you to another specialist when you develop new symptoms. And sometimes you need to be proactive. For example, here in Toronto, my neurologist referred me to an ophthalmologist after I shared my concerns about developing cataract from long-term use of prednisone, one of my immune suppressing medications. So it's kind of interesting that things went a full cycle, that I was diagnosed by ophthalmologist, see a neurologist, and then the neurologist in turn have to refer me to a ophthalmologist again because of the side effect of the medication that I'm taking. So these are just some of the skills we need to have in order to live healthy with chronic conditions. Unfortunately, there isn't enough time to cover them all today. But here are some resources that I found helpful if you'd like to find out more about living healthy with chronic condition. The first thing that I want to mention is that is this workshop called Chronic Disease Self-Management Program. It is a 6-week workshop. Each session is about two and a half hour long. It's based on a model developed by the Stanford University. And I know that this workshop is given internationally in many, many different countries and different languages. And for more information, obviously, you can go and find the sessions available in Toronto. That's the URL right there. Or what you can do is you can Google Choose Health Toronto, just like the title said, Choose Health, and then Toronto. These 3 keywords will probably will lead you to the link to the website. If you take this self-management program, they actually gave you a free book called, and this here's on the screen, Living a Healthy Life with Chronic Conditions by Kate Lorick and others. But if you're unable to take the workshop or in the near future, then this book is also available for purchase on Amazon.ca. So you can get the book independently, whether you take the workshop or not. We are talking about the importance of good communication with your care team. The National Institute of Health talking to your doctor webpage is very, very helpful there. This site has videos and tips on how to have clear and honest conversation with your healthcare team. And of course, I mean, if you are a patient of the UHN, of the UHN system, then the UHN patient and family library team is always there to help you. So I think Melissa will probably provide the contact information there later in this talk. So that's all I have to say today. Thank you very much for your attention.
Thank you so much, Manfang, for sharing your experiences, tips, and resources with us. It is really neat that there is that full circle moment between your healthcare teams. Now we'll move on to the rest of our presentation. So until about 1:50 p.m. today, we'll hear from Dr. Sit, who will share her expertise around common eye conditions and how they're treated, ways to keep your eyes healthy, and some resources at UHN and in the community that can help you learn more about eye conditions and eye health. So over to you, Dr. Sit.
Thank you very much, Melissa. Thank you very much for inviting me for this opportunity to speak to the public about how to keep our eyes healthy. It's a very important topic, especially when we're using our eyes so much at home. So the first thing I wanted to do is we're going to start off the presentation by introducing you to the human eye and talking a little bit about the structures involved in the human eye and how it works. Next slide. The human eye is a very complex organ. It's so important to our everyday lives. It helps us see things in the distance. It helps us see things up close. It helps us see color. We call that color vision. It helps us see things in stereo vision, such as in 3 dimensions. Also, both eyes, we have 2 of them, they work in a coordinated way. For example, when you look right, both eyes will look right. When you look left, both eyes will look left. So we have 2 eyes working together all the time. Next slide, please. This is a picture of the front part of your eye. So you see there's an eyelid at the top where you have eyelashes coming out. The sclera is the white part of the eye. The iris is the colored part of your eye. In this picture, it's a blue color, but there's many different colors. Some people have green eyes, some people have brown eyes, some people have blue eyes. The pupil is the black part in the middle where light goes into the eye. The limbus is at the edge where the white part meets the colored part of the eye. Next slide, please. How do tears form inside our eye? Well, up inside the eyelid, there's a gland. It's called the lacrimal gland. And from there, it produces the tears. And this is what keeps our eyes moist. This is what is produced when we start to cry, when we are sad, or when we are happy. The tears can come from the lacrimal gland, and then they will flow out into the lacrimal sac. From the lacrimal sac, they flow into the back of your nose. So this is why when you cry, you might taste the salty tears at the back of your throat. Or when you use eye drops, you might also taste some of the eye drops at the back of your throat. Next slide, please. Now here's a picture of the inside of your eye. So if we assume here that we had cut the eye in half, so we're looking right in the inside. So the front part is the cornea. That's the clear window at the front part of the eye. Next, I want to show you the lens. So the lens is what allows us to focus up close and at a distance that is inside the eye. Manfang was talking about cataracts before, so we will talk more about the lens and cataracts later. The retina is like the film on a camera. It's located at the back of the eye. It's like the film on a camera because it takes the picture and it sends the picture to our brain. Now we have the optic nerve, and that's the cable that connects the eye to the brain. So it sends whatever messages we are seeing into our brain so that our brain can process what we're actually seeing. Next slide, please. Here it shows that we have the eye at the front here and how it's connected to the brain by the optic nerve. So our eye sees the images, it sends the images back to the brain through the optic nerve, and then what we see is processed by the brain in different areas called the lateral geniculate nucleus and also the visual cortex. These two areas are part of our brain, and this is how we see. Next slide. Next, I want to tell you a little bit about different members of the team of eye care professionals who might look after your eyes. So I'm an ophthalmologist. So I'm a medical doctor, and we specialize in vision care. We can provide comprehensive eye exams. We can prescribe and give medications to treat your ocular conditions. We can also perform eye surgery. Next, you might need an optician. So say you need some glasses or contact lenses. You might go into a shop and an optician there will help you select the correct lenses and contact lens for you. They will fit you for your glasses and your contact lenses. Next, you might have an optometrist involved in your care. This is a non-medical provider who is well trained to assess your visual system. They can diagnose and treat refractive disorders. So if you need glasses, they can prescribe you glasses. For example, if you are farsighted or if you're nearsighted, or if you're presbyopic, meaning if you're a little bit older and you need reading glasses, then they can prescribe and dispense you these glasses also. Sometimes they might prescribe you certain medications if they feel that you need it. If you need to see an ophthalmologist, they will also direct you to see a medical doctor who's an ophthalmologist. Next slide, please. Next, I want to move on. Next slide, please. Next, I want to move on to what you should expect at your eye exam. So when you go to an eye exam, you can expect that the first visit to an ophthalmologist or an eye care professional might take a little bit longer. The follow-up visits subsequent to that might be a little bit shorter. We often ask you questions, so we take a history. We'll ask you questions about your eyes, about some of the symptoms you might be experiencing. For example, if your eyes are blurry or if you're having pain in your eyes. We'll also ask you questions about your general health. So this is important because we might want to know if you have diabetes, if you have other conditions, and we also want to know what medications you take. We'll also examine your eyes. Next slide, please. So, to make the most out of your appointment, you want to bring the following things. You will need your health card. As I said before, you'll need to know details of your medical history. So if you have this written down in a list, that would be very, very helpful. A list of medications you take, and this includes not just your eye drops. We want to know all the medicines you take. For example, if you were on a drug called prednisone or other medications, some medications can have side effects on your eyes, and we want to know all the medications that you're taking. You also want to bring your most recent pair of eyeglasses. because when we take your vision, we want to see how well you can see and what glasses you're wearing to help you see better. You might want to bring someone to drive you home because after your eye appointment, your eyes might be a little bit blurry. Next slide, please. So the first thing we'll do at your eye exam is we want to see how well you can see. So there's usually an eye vision chart. We'll ask you to cover your left eye first, and then we'll see how well your right eye can see. Next, we'll ask you to cover your left eye, and then next we'll ask you to cover your right eye, and we'll see how well your left eye sees. So we test one eye at a time because we want to know how each eye can see on their own. The vision chart might be letters. However, we can also use numbers. And for very small children, we might even use pictures when they can't read letters or numbers. Next slide, please. Next, we sometimes test your visual field. So your visual field, it tells us how your peripheral vision is. So we will ask you to cover one eye, and then what we might do is we'll show you some fingers out to the side, and then we'll ask you how many fingers you see, or if you see fingers moving out from the side of your vision. And again, we'll do this one eye at a time. This is for us to test your peripheral vision. Next slide, please. Next, we might want to test how well your eye muscles are working. So as I said before, you've got two eyes, and they both have to work together in order to see one image. So we might ask you to look at our fingers, and then we'll move our fingers to the left. We'll move our fingers to the right, up and down. And when we're doing that, we're looking to see if your eye muscles are moving your eyes in a coordinated fashion, both eyes moving together. Next, we will want to look at your pupils. So your pupils are the round dark part inside the colored iris that you see. So when we shine light into your pupil, it will get smaller. When we take the light away and you're in a dark room, then the pupil should expand and get bigger. Looking at your pupils gives us an idea how your optic nerve might be functioning or how your visual system is functioning. So this is very important information to us. Next slide, please. Next, we might examine your color vision. So again, we would do each eye separately. We would ask you to cover your left eye. We would then test the right eye, and then we switch where we cover the right eye, and then we test the left eye. So color testing allows us to find out how well you can see different colors. Some people might have difficulty seeing colors because they have color blindness, which they had since they were a child, and this was inherited. Other people might have difficulty seeing color from an acquired point of view, where they could see color as a child, but maybe they lost the ability as they grew older. Next slide, please. Next, eye drops, everybody's favorite, eye drops. So we might use eye drops at your eye exam. There's different types of eye drops, and they all have different functions. So the one type of eye drop is an anesthetic eye drop. And what it does is it freezes your eye a little bit so that when we do various things during the examination, you won't be in discomfort and you'll be very comfortable. The next thing we might put in might be dilating eye drops. Now, the dilating eye drops are used to dilate your pupils. Now, it makes your pupils larger so that we could look inside the eye. The problem with dilating eye drops, though, is they take a little bit to work. So we'll put them in. We might ask you to sit and wait for 10-15 minutes before we can continue the exam. The other thing is it might make your vision a little bit blurry afterwards. And this is why you might need to bring someone with you to your appointment so someone can drive you home. Next, it will also increase your sensitivity to light and might make you a little photophobic. So if it's a very bright day outside, you might want to bring a pair of sunglasses with you to your eye exam so that after you leave your appointment, you will be more comfortable when you're walking around outside in the bright sun. Next slide, please. Next, I want to show you some of the equipment that we're using. So one of the most important pieces of equipment that we have in our office is called this slit lamp. So we'll ask, essentially a microscope. What it allows us to do is to look at your eye and magnify what we see so we can see all the fine details that are there. So we'll ask you to put your chin inside the slit lamp, and then we'll bring the microscope close to you. Using this tool really allows us to see a magnified view of all the different structures in your eye, and it can help us figure out what is wrong. Next. So this is a picture of what I would be seeing if I'm looking at your eye. So the thinnest beams of light help us see detail, and we shine it into your eye. And then we can see different details in your cornea, for example, in your lens, in your iris. Next slide, please. Next, so we've now put the eye drops in your eyes, and that was for us to see into the back of your eye. So this is a photograph of your retina. So it helps, looking at your retina, we could see different diseases such as diabetic retinopathy, macular degeneration, or optic nerve problems. So when we look at the back of the eye, this is what we're looking at. Next slide, please. Next slide. Next, I want to introduce you to different eye conditions that are very common that come up. So we are going to first talk about cataracts, then we will talk about glaucoma, then we will talk about retinal disorders. We will talk about pink eye and also dry eyes. So the first thing I want to do is talk about cataracts. So cataracts are of interest to a lot of people, and because it is the leading cause of vision loss in adults age 55 and older. It is very common. It happens with age. And with an aging population, this becomes something that is very important for us to know. What is a cataract? It's when the lens of the eye becomes cloudy with age. Now, age is the most common reason for developing a cataract, but cataracts can develop for other reasons too. For example, with the long-time use of certain medications, cataracts might develop more quickly, such as the use of prednisone. If you've been on the medication prednisone for a long time, then you may develop a cataract at a younger age. So I want to point out first I want to point out first on the left side, we have the normal lens. When you look through the pupil, it looks black. Not that it's black, it's just there's nothing that's blocking the view, so it looks black. But if you were to develop a very dense cataract, it can start looking like this white color. And as you can imagine, if we can't see through that white cataract into your eye, you won't be able to see out of that white cataract either. Now on this side, we have a picture of a normal lens, and you can see the light shining into the eye, and then the light becomes focused onto the retina. And as I was saying before, the retina is like the film of the camera. It takes the picture and then it sends the image to your brain. So if you have a clear lens, then the light can come in very easily and it can focus onto the retina. However, with age, when your lens becomes cloudy, now that light isn't coming in so well through that cloudy lens. And even some of the light that comes in through that cloudy lens, it doesn't focus very well onto the back of the retina. Some of that light might scatter all over the place, and it doesn't focus a clear image onto the retina. Next slide, please. So what are some of the symptoms of a cataract? What would you as a patient feel? So you wouldn't feel any pain if you had a cataract. What you would notice is that your vision might become blurry or foggy. And usually it's a very gradual decrease in vision over time. It's not a sudden decrease in vision. Bright colors might not look as bright as they used to, and they start looking more and more dull. Things might look a little bit more gray or yellow. You might find that your glasses that seem to be working don't seem to be working as well anymore. You might find that you need to change your prescription for your glasses more frequently. Sometimes you might see glare, for example, around street lights at night, or when you're driving and headlights are coming on towards you, you might see a glare or a halo around lights. And driving at night might become more difficult. So on the right here, I have a picture of, for example, if you're looking at a flower and you don't have a cataract, you can see the detail and the edges of the flower very well. However, if you were to develop a cataract, then your vision would become more blurry and the edges are a little bit more blurry. You might see a little bit of ghosting around the edge of the flower and things are not so clear anymore. Next slide. Thankfully, we have something that can fix cataracts. Now we can perform cataract surgery and that can help improve your vision. So what we do is, this is microsurgery. It's done under a microscope. The clouded lens is removed with a technique called phacoemulsification, where we do the surgery through a very small incision of less than 2.5 millimeters. And we break up the cloudy lens and we take it out through this phacoemulsification tip. After we remove the whole lens, we insert something called an intraocular lens. That intraocular lens is inserted into the eye and it stays there permanently. That now has replaced the cloudy lens of your eye. And that lens that we've inserted, the intraocular lens, will help you focus so that you can see. Cataract surgery is usually day surgery. You don't need to stay in the hospital overnight. You come have your surgery, and after the surgery, you'll be able to go home right afterwards. We don't usually put people to sleep for the surgery. It's done usually under a local anesthetic, and we can give you some medication to help you relax, but we don't need to put you to sleep for the surgery in most cases. Next slide, please. Next, we're going to shift gears a little bit and talk about glaucoma. Glaucoma is the most common cause of preventable blindness. There's two most common types of glaucoma that I want to touch upon. The first is chronic open-angle glaucoma. And in open-angle glaucoma, this is a painless condition where it's often, but not all the time, often associated with very high pressure in the eye. We call it open angle because what happens is the angle is the structure in the eye that allows the fluid to drain from outside, allows the fluid to drain out of the eye. The angle is open in chronic open angle glaucoma so that it is not a crowded space. So we call it open angle. And again, in this condition, it's usually painless, sometimes with high pressure in the eye. Next, there's acute angle closure glaucoma. So this is different, where this is a very painful condition. It often happens very suddenly, where the pressure in the eye goes up very high. And this is because that angle or that drainage mechanism in the eye is very crowded there. And when it becomes very, very crowded, fluid can't get out and the pressure suddenly builds up very high. And in which case, that needs to be treated right away, or that can threaten your sight. It would be treated by medication, eye drops, pills, and also laser treatment. Next slide, please. So high pressure inside the eye can damage your vision. And how does it damage your vision? Well, so this is a picture where there is high pressure in the eye, and it can cause damage directly onto the optic nerve, which is at the back here. Now, the optic nerve, remember, is what connects the eye to the brain. So it's carrying the message from the eye to the brain. And if that optic nerve is damaged, then it won't be able to carry that message very well. So it's very important to protect the health of the optic nerve by making sure that the pressure doesn't build up very high inside your eye. Next slide, please. What are some symptoms of glaucoma? Well, as I said before, with the open angle type of glaucoma, you might not have any symptoms because this is painless. You might not have any symptoms until it's at its advanced stages. With the acute angle closure glaucoma type, you can have a sudden attack of this glaucoma, and where you might have sudden pain inside your eye. You might start suddenly seeing large halos around light sources. You might have a feeling of nausea, vomiting. Your eye becomes very red, and it can suddenly become very, very blurry. These would be symptoms of acute angle closure glaucoma. Next slide, please. So I said for open angle glaucoma, you might not have any symptoms at all. So how would we know, or how would you know if you need to be concerned about that? Well, here are some risk factors for open angle glaucoma. So as you get older, your risk of glaucoma increases. If you have a very strong family history of glaucoma, if your parents, your grandparents, or if you have aunts and uncles and they all have glaucoma, then you would have a very strong family history. And this puts you at added risk of having glaucoma yourself. If you already have high eye pressure and large changes in your eye pressure, this is also a risk factor for glaucoma. So when you go get your eyes examined and they tell you, oh, your eye pressure is a little bit high, this could be a risk factor for glaucoma. At your eye exam, they might tell you that your cornea is thin. This is also a risk factor for glaucoma. Sometimes when your eyes are examined, we might find bleeding on your optic nerve, or we might find a difference in the two eyes between the optic nerves. This is also indicating a risk factor for glaucoma. And if you had many of these risk factors, then you should be investigated for glaucoma or monitored. Next slide, please. So how does glaucoma affect your vision? Because I said the open angle glaucoma type is painless. So how could it affect your vision? So this is a picture of what someone would see with very advanced glaucoma. So glaucoma can cause damage to the optic nerve, and it basically causes a tunnel vision. So what happens is you start losing the peripheral vision, and you can only see things right into the middle. This would be a very advanced case of glaucoma where you would only be able to see things into the middle. Next slide, please. So if you were a patient that has glaucoma, or we're investigating you for glaucoma, what do we need to do? Well, we might need to measure the pressure of your eye. So we do this with a tonometer. So the gold standard of care is to measure it using something called applanation tonometry. So what we do is we put some anesthetic eye drops in so you don't feel any discomfort, and then we touch the surface of your eye with a small instrument. Now you won't feel this really because we've already put the anesthetic in, and this allows us to measure the pressure in your eye. This is called applanation tonometry. Next slide, please. Next, we might do a visual field test. So as I was saying, glaucoma can damage your peripheral vision. So we need to do a visual field test. And this is a visual field test machine. And we can use it to test how well you see out of the periphery. So you can sit with your chin in this machine. And what this machine does, it shows you lots of dots and lights in the periphery of your vision. There's a button for you to click every time you see a light. And that gives us an idea of how well your peripheral vision is functioning. Next slide, please. We might do special scans and images so that we could look specifically at the optic nerve. Now, these are two pictures of optic nerves showing you a normal one and an abnormal one. And the enlarged one, what happens is that shows you glaucoma damage over time. And we might do special scans to help us look at the very small nerve fibers that might be damaged in glaucoma. Next slide, please. So what treatments do we have for glaucoma? Well, for glaucoma, the only treatment we have, or the goal of treatment, is to lower the pressure inside your eye. So often glaucoma patients are treated with eye drops. So how do we put eye drops in? We want you to tilt your head back. We want you to lower your lower eyelid and just drop an eye drop into the pocket of your lower eyelid. And then you can close your eye and rest for a couple minutes. If you have multiple eye drops to put in, you might want to wait a couple minutes between each one. Next slide, please. Another kind of glaucoma treatment would be laser treatment. So we might do something called laser trabeculoplasty. So we have lasers that direct a very focused beam of light into the angle of your eye, and this can help the drainage mechanism and it can help drain fluid from inside your eye. Next slide, please. Next, we have different types of surgeries called trabeculectomy surgery, tube shunt surgery, and stent surgery. All these surgeries, the goal of all of them is to improve the drainage mechanism inside the eye so that the pressure is lower inside the eye. Next slide, please. Next, I want to talk a little bit about diabetic retinopathy. So diabetic retinopathy is something that can affect your vision. Next slide, please. So people with diabetes can have vision loss, and this is because the effect of high blood sugar over years on your blood vessels can cause leakage into the retina, and it can cause bleeding into the retina. The longer you have diabetes, the higher the chance you could have problems with your eyes. Next slide, please. There's different types of diabetic retinopathy. One is called non-proliferative diabetic retinopathy, where you can have swelling at the back of the eye. It can also cause macular ischemia, where the blood flow is not great because of the effect of the diabetes. Proliferative diabetic retinopathy happens when the retina starts growing new blood vessels inside. Now, the new blood vessels are not good, though, because they can cause bleeding, scarring, and also retinal detachments. Next slide, please. So I want to show you a picture of a normal retina without diabetic retinopathy and one with a picture with diabetic retinopathy. So on the picture on the right here, you can see that there's lots of bleeding. There's these yellow spots that are exudates, and there's swelling in the middle of the eye. This would all affect your vision and make you see things blurry and not clear. Next slide, please. Non-proliferative diabetic retinopathy. This is also just showing you the bleeding that can happen and the swelling that can happen. Next slide, please. Now, in proliferative diabetic retinopathy, I mentioned that blood vessels can start to grow and you can get bleeding. Now, these abnormal blood vessels are very fragile, so then it can start causing big hemorrhages like this one. Next slide, please. Symptoms of diabetes. You can get blurry vision, and you can start getting patches of your vision missing, just like in this photo where you can't see everything clearly. Next slide, please. For diabetic retinopathy, there's different types of treatments. One is with laser. Again, we use a laser to direct a very focused beam of light to treat the damaged part of the retina. Next slide, please. We can also inject medications called anti-VEGF. So these medications are injected right into the eye, and they can decrease the swelling in the eye, and they can also decrease the formation of new blood vessels. Next slide, please. Next, I want to talk to you about age-related macular degeneration. This affects people usually in the older age category. It's a chronic degenerative retinal condition, and it damages the central vision usually. There's a wet type of macular degeneration and a dry type. The wet type can cause severe and permanent central vision loss if not treated. The dry type, it usually is less severe, but it can progress very slowly. Next slide, please. So in macular degeneration, this is what someone might see if they have macular degeneration. Their vision might be very blurry. Straight lines might look a little bit wavy, and you could be also missing patches of your vision centrally. Next slide, please. Risk factors for macular degeneration include smoking, not having enough antioxidant vitamins and minerals, having too much exposure to sunlight. Again, family history is very important here. So a strong family history of macular degeneration. Other health factors might be having high blood pressure or living with obesity. Those are risk factors for macular degeneration. Next slide, please. So there were two types, I said. One was the dry and one was the wet type. The dry type causes small deposits on the retina called drusen. This can affect your vision. Next slide, please. One self-test that your doctor might ask you to do is, this is an Amsler grid. You can take it home and we ask you to test one eye at a time. You look at this black dot in the middle, and then we ask you, while you're looking at the black dot, do all those lines look nice and straight and the boxes are all equal in size? If any of the lines look wavy or distorted, then you will need to let your eye care professional know. this might indicate that you've had a change in your condition or you have something new that's developing. Next slide, please. How can you decrease your risk of macular degeneration? Well, you can avoid smoking, having a balanced diet, maintaining a healthy body weight, use sunglasses whenever you're outside for UVA, UVB protection. And there's also a vitamin called AREDS2 formula vitamin, which has vitamin C, E, lutein, and zinc in it. And those vitamins are to help slow down the progression of disease. Next slide, please. Wet macular degeneration can cause bleeding at the back of the eye, and we call that a choroidal neovascular membrane. Next slide, please. So for wet macular degeneration, if you were to develop a choroidal neovascular membrane, we can treat you with medications that are the anti-VEGF medications. That can decrease the swelling and that can stop the blood vessels from bleeding at the back of your eye. And hopefully this type of treatment can help restore your vision or maintain what vision you have. Next slide, please. Next, I want to talk to you about floaters. So this is a very common symptom that people have. So next slide, please. Floaters, now we all have a jelly inside the eye that's called the vitreous jelly. As you get older, the jelly shrinks and it detaches from the back of the eye and it causes little clumps of this jelly inside your eye, and you can see them as floaters. Next slide, please. The floaters can make you see squiggly lines, cobwebs, or it might look like little bugs are flying around. Next slide, please. However, floaters are often not dangerous, but sometimes they could be something indicative of something more dangerous. Next slide, please. Sometimes a floater could be a warning sign of a retina tear or detachment, and this is a serious eye problem. Next slide, please. When there is a rip in the retina, just like in this picture, that could be the beginning of a retina detachment, because with a rip, then the whole retina can start falling back from the back of the eye. A retinal detachment can cause severe vision loss. Next slide, please. So what are symptoms of a retinal detachment? You can see a curtain coming down, half of your vision, like this black curtain here, and it can cause you to lose your vision. Next slide, please. We can treat retinal tears with laser treatment. So we basically use a laser to seal all around the retinal tear so that the retina doesn't fall off from the back of the eye. Next slide, please. If you were to have a retinal detachment, though, we could treat you with something called pneumatic retinopathy. This is where we inject a gas bubble into the eye. The gas bubble then rises and tamponades or pushes the retina back into its place. And after it pushes the retina back into its place onto the back of the eye, then we go and laser it so that it stays in place. Next slide, please. Retinal detachments might also be repaired with a scleral buckle. And basically what this is it uses a buckle to encircle the eyeball. So when we tighten the buckle, it brings the detached retina back closer to the eye of the wall of the eye, so that the retina is now close to the eye wall. And from there, we can then laser it to make sure it doesn't detach again. Next slide, please. Retinal detachments can also be repaired with pars plana vitrectomy. And this is when we go inside the eye and we remove the jelly inside the eye. And after that, we can inject some saline, a gas bubble, or silicone oil to keep the retina attached. Next slide, please. Next, I want to talk about eyelid bumps and lumps. So, this is a very common problem. Next slide, please. Often you might have, I see patients with styes or chalazions. So a stye is when one of the eyelash follicles become inflamed and you might have a bump on the outside. A chalazion is like a cyst that occurs in the eyeball because one of the oil glands becomes blocked. So it's almost like a pimple on your eyelid. This would be a picture of one right here. Next slide, please. The treatment for a chalazion, often with warm compresses, if you're diligent of putting warm compresses on at least 10 minutes a day, then it can help the chalazion resolve on its own, and you might not need to have treatment. Sometimes you might be recommended to have some antibiotics if it becomes very inflamed. Sometimes if it doesn't go away, then we will have to drain it with surgery. Next slide, please.
Thanks, Dr. Sit. I'm wondering if we may want to just skip to the how to keep your eyes healthy during, or if someone is having a lot of screen time, just being mindful of time, if that would be okay with you, or did you want to quickly just go through the other parts?
I think we could quickly go through it.
Okay.
A couple minutes.
Okay.
Next thing is pink eye, which is conjunctivitis. This is also a very common eye condition. Next slide, please. So it's when the white part of the eye becomes inflamed. So it can be caused by viruses, bacteria, or allergies. So here's a picture of a conjunctivitis at the bottom where you can see that the eye is very red. Next slide, please. So depending on what the pink eye causes, some of the recommended treatments might be antibiotics or allergy eye drops, such as antihistamines or mast cell stabilizers to remove the cause that's making your eye red. Next slide, please. So dry eyes is also very common, and the prevalence of it increases with age. Next slide, please. Dry eyes happens when your eyes don't provide enough moisture to keep the surface of the eye very lubricated. So it's either because you can't make enough eye tears, or the quality of the tears that one's eye is making is not good enough. Next slide, please. Symptoms of dry eyes include stinging, burning. You might feel like there's sand or rocks inside your eyes. Next slide, please. So to prevent dry eyes from happening is often when we're staring at things for a very long time. For example, our computer screen, we're not blinking our eyes enough. So we need to remind ourselves, we need to constantly blink enough so that our eyes become lubricated. Contact lenses can also cause dry eyes to be worse. So if your eyes are really dry and you're a contact lens wearer, you might want to consider limiting the use of your contact lenses or shortening the amount of time that you use them. You can also use artificial tears as prophylaxis so that your eyes don't become dry. Next slide, please. If you do have dry eyes, then we recommend using artificial tears and use them frequently, 3-4 times a day, so that it could lubricate your eyes. You can also use omega-3 nutrients, and this will help dry eye syndrome. Sometimes when no treatments are working for you that you've tried, and then your doctor might recommend certain medications. Sometimes we might put plugs inside your tear ducts so that your tears don't drain out so quickly. So whatever tears you make stay in the eye longer. Next slide, please. Blurred vision. So a lot of people, next slide, can have blurry vision for many reasons. So one, you could have blurry vision because you just simply need glasses, whether you're farsighted, nearsighted, or you're presbyopic, meaning that you have a decreased ability to read with age. Glasses might help you in that regard. Other blurry vision causes might be any problem along the visual pathway. So this starts from your cornea, your lens, your vitreous. If there's any disease anywhere along that pathway, then this can cause your eye to be blurry, including diseases of the retina and also the optic nerve. Next slide, please. So let's talk about how to keep your eyes healthy. So, a lot of things with preventative medicine, we can prevent bad things from happening later on. So I would suggest going for routine eye exams. After you're 40 years old, you might notice that you have difficulty reading. Now, this is presbyopia, which is a normal condition that causes a decreased ability to read with age. But having regular eye exams can have all these things checked out. Especially if you have a family history of eye problems, then you should have regular eye exams. When you're outside, I suggest wearing sunglasses, avoid smoking, and maintaining a healthy diet with lots of dark green vegetables. Next slide, please. In times of COVID and during a pandemic, we're all glued to our computer screens a lot. Whether you're working or you're a student, everybody's sitting in front of their computer screens for hours and hours on end. And this can really cause a lot of fatigue. Now, a good rule of thumb is after 20 minutes of staring at a computer screen up close, you should really try to refocus your eyes at a distance, for example, looking out the window. And then what this does, it can relax those eye muscles that are straining to look at something up close. And when you relax those eye muscles, it gives your eyes a break, and then you can come back to your screen. But you should really try to do this every 20 minutes so that your eyes aren't looking at the computer screen at a set close distance for prolonged periods of time. Another tip would be to try to make sure that the light contrast between your screen and your room are very similar. So, a very, very bright computer screen sometimes causes strain on your eyes. Not just your eyes, but your workstation ergonomics are very important. Like, you have to make sure that you're sitting comfortably at a chair. The angles are all adjusted appropriately so that you're not strained in a certain way or in a very odd and awkward body position, because it can strain anything along besides your eyes. Also your neck, your hands, your back, your arms. And a good tip is also try to avoid any kind of screen time an hour before bed, just to give your eyes a rest and also to give your brain a rest. Next slide, please. Now, this next slide is about accessing eye health services in Ontario. If you have a medical condition that requires medical care, this is covered by OHIP, so you don't need to be worried. For example, if you had conditions like diabetes, glaucoma, cataracts, retinal disease, amblyopia, a visual field defect, corneal disease, strabismus, where you have one eye that wanders, uveitis, which means inflammation, optic pathway disease, which is optic nerve disease. All those conditions are covered by OHIP, and you will be covered by the Ontario Health Insurance Plan. Next slide. If you don't have OHIP, there are other programs that you might access. For example, there's a interim federal health program for people who are refugees, or if you are part of a community health center, they might be able to help you access these health programs. Next slide, please. There's also an assisted devices program through the province of Ontario for people who have long-term low vision or blindness, and they might be able to help them with assisted devices. Next slide, please. Next are some slides just talking about some resources if you want to learn more about eye health. So www.seethepossibilities.ca is created by the Canadian Ophthalmological Society, and it has very good, accurate information that you could learn, and it's geared towards the general public that you can learn about different eye conditions. I think this is the end of my presentation. Thank you very much.
Thanks so much, Dr. Sid. And just to close, so as Manfong mentioned earlier, if you do have questions or want to look for more health information about eye health, please contact our UHN patient and family libraries, and our librarians would be happy to help you find the information you're looking for. So I know we are over time, but I just wanted to thank you, Dr. Sid and Manfong, for sharing your expertise and experience about eye conditions with us. So I'm just going to check our Slido very quickly, and let's try to answer the top 2 questions, and then we'll close for the rest of the afternoon. So just taking a look at our Slido here. So the first question is actually about screen time again. So I guess Dr. Sid, so someone was wondering, with the increase in screen time, how do we protect our eyes long-term besides taking breaks at the computer? So are there any other tips that you would suggest on top of the ones that you had listed earlier, or perhaps doing a quick summary of the ones you had mentioned? Great.
Yes, so I think for something as screen time, because we're all, I think screens are not going away in our lives. It looks like even without a pandemic, we're all in front of our screens a lot. So I think it's just having a routine that we can build into our everyday lives that would help in the long run. So those would just be the things of giving ourselves a break every 20 minutes, trying to look away and making sure that you give your eyes a break. If you need glasses, you should be wearing the correct prescription so you don't put added strain onto your eyes. And then again, we talked about the ergonomics of it. If you have dry eyes, you should be using artificial tears, because that might help with some of the dry eyes if you're staring at your computer screen for too long and not blinking enough.
Thank you. And I know the one tip that we were talking about, like you had mentioned earlier, about making sure the light contrast between your computer or your screen and your room is very important. That wasn't something I had thought about either. So I'm sure many will also find that really helpful. Thank you. So I guess just one more question here. Someone has said, I am short-sighted, so 1.75 degree on eye and 3 degree on the other, and they want to have LASIK surgery to correct their vision. I am 30 years old this year. What are the chances of negative side effects? And if the surgery makes their eyes weaker when they get older?
So the question whether you'd be suitable for LASIK surgery. So what you would have to do is, I recommend having an assessment at a laser surgery clinic, because it's not just the prescription that they want to know. So they will want to know has your prescription been stable over time? Because if your eyes are still changing very rapidly, then even if you do the surgery today, if your eyes change after the surgery, then you might still need to wear glasses. So there's various factors that they want to know. They want to do measurements to see if your cornea is healthy. They want to know if your prescription has been stable over time, because if it's not, then maybe this is not the right time to do surgery. Every procedure has risks, and LASIK has been around, and laser eye surgery and different variations of it have been around for a very long time. They are very safe, but depending on the certain health of your eye, it may or may not be suitable for you. So my recommendation is definitely, if you're interested, though, you should be assessed at a laser center where they can look at all the things that are important to consider whether you would be a good candidate for laser eye surgery.
Thanks, Dr. Sit. And I think that's a great takeaway too. So if you have any questions about your own eye health, definitely talk to your own healthcare provider. And using the tips that Manfong shared at the beginning too could be a really great way to get the questions or the answers that you're looking for. Thank you. So I am mindful of time, and I realize we are past 2 o'clock now. So I just wanted to thank you both again for sharing your expertise and taking the time with us to share those resources and information with us. And for everyone joining as well, thank you so much for attending today's session and submitting your questions. If we didn't get a chance to answer your question, please email us at pfep@uhn.ca, and we'll try our best to respond within 1 week. And of course, your feedback is important to us, so please go to the link on your screen and complete the survey, or you can scan the code using your smartphone's camera or QR code reader app, and it'll take you straight to the survey. And finally, to find out about our next talk, subscribe to our MailChimp newsletter and get up-to-date information about events and new resources at UHN. And to fill out a form to subscribe, please go to the link on your screen or scan the code. Thank you so much, and we look forward to seeing you at our next session.